So we all know phosphodiesterase is an enzyme which can break cyclic AMP and cyclic GMP. These are metabolized with the help of phosphodiesterase enzyme. So if we inhibit this enzyme, there is increase in level of cyclic AMP or cyclic GMP. Okay. Now there are various forms, isoforms of phosphodiesterase enzymes, and we have drugs inhibiting different forms. So most important, you need to remember about phosphodiesterase 3, phosphodiesterase 4, and phosphodiesterase 5. These are the three main on which we have drugs. Now phosphodiesterase 3, it is present at two main places, one in the platelets and second is in the heart. In the platelets and in the heart we have phosphodiesterase 3. So when we inhibit phosphodiesterase 3, there will be increase in cyclic AMP in platelets and in heart. When platelets get more cyclic AMP, the aggregation stops. Remember, PGI2, which normally inhibit platelet aggregation, it acts through cyclic AMP. So when cyclic AMP increases, there is anti-platelet action. Okay. Then in the heart, cyclic AMP stimulate the heart. So when we increase cyclic AMP in heart, there will be inotropic action. So phosphodiesterase inhibitors, particularly 3 inhibitors, they may have antiplatelet action and they may have inotropic action. Okay. Then phosphodiesterase 4 is present in bronchus, and it is also involved in releasing the inflammatory mediators. That is important. Phosphodiesterase or cyclic AMP, it increase the inflammatory mediators. So if we inhibit phosphodiesterase, there will be increase in cyclic AMP, so that can lead to bronchodilation. Remember, cyclic AMP cause bronchodilation, whereas inflammatory mediator release is inhibited by cyclic AMP. So when we inhibit phosphodiesterase 4, more cyclic AMP occur, so there will be decrease in the inflammatory mediators. So in many conditions, inflammatory conditions, we can use phosphodiesterase 4 inhibitors. Then phosphodiesterase 5 is mainly involved in metabolism of cyclic GMP. So when we inhibit phosphodiesterase 5, cyclic GMP increases. And when cyclic GMP increases, it can produce action at two main places. One, it will cause treatment of erectile dysfunction. It lead to erection. So in the corpus cavernosus, there is presence of cyclic AMP, cyclic GMP that cause vasodilation. And second, phosphodiesterase inhibitor will increase cyclic GMP, and that we can utilize in pulmonary artery hypertension. Vasodilation will occur and pulmonary artery pressure will decrease. So these are the major actions of phosphodiesterase and what the inhibitors will do. So now we can move to the drugs. So we have 4 type of drugs. One are phosphodiesterase 3 inhibitors, then phosphodiesterase 4 inhibitors, phosphodiesterase 5 inhibitors, and then we will have some non-specific drugs also. Okay. So phosphodiesterase 3 inhibitors, we discussed, they have 2 major uses. One, antiplatelet, and second, they are used also for inotropic action. Now for antiplatelet action, phosphodiesterase 3 inhibitors we have are cilostazol and dipyridamole. Cilostazol and dipyridamole, they inhibit the platelet aggregation, and this is utilized for treatment of intermittent claudication in case of cilostazol, and for thromboprophylaxis, particularly post-operative thromboprophylaxis in case of dipyridamole. Then we have another drug called as anagrelide. Anagrelide not only inhibit platelet aggregation but also inhibit the platelet death. The programmed death, or we can say apoptosis of the platelets, that is inhibited by this drug. So it is used in thrombocytopenia, particularly in myeloproliferative disorders. In myeloproliferative disorders, thrombocytopenia may be seen. Anagrelide is indicated for that indication. Okay. Then coming to second, inotropic action. Inotropic action we want in decompensated heart failure, and the drugs used are amrinone and milrinone. Amrinone, milrinone are phosphodiesterase 3 inhibitors used in congestive heart failure, particularly decompensated heart failure. Okay, so that is phosphodiesterase 3 inhibitors. Then coming to phosphodiesterase 4 inhibitors, we discussed 2 major actions of phosphodiesterase 4 inhibitors. One, they cause bronchodilation. And second, these drugs may inhibit the release of inflammatory mediators. So we can utilize these for COPD. Roflumilast is a drug which is used for COPD. It is causing bronchodilation. And apremilast is a drug, and crisaborole are the drug which inhibit the release of inflammatory mediators. Apremilast is used for psoriasis and psoriatic arthritis, whereas crisaborole is used for atopic dermatitis by inhibiting the release of inflammatory mediators. Okay. Then phosphodiesterase 5 discuss two major actions. One, it cause erection, and second, it decrease pulmonary artery pressure. Pulmonary artery pressure. So we can utilize the phosphodiesterase 5 inhibitors for treatment of erectile dysfunction. Now what is important is all the phosphodiesterase 5 inhibitors we have, sildenafil, vardenafil, avanafil, tadalafil, all can be used in erectile dysfunction. So erectile dysfunction is a general indication where all phosphodiesterase inhibitors can be used. But for pulmonary artery hypertension, two drugs are approved. One is tadalafil, second is sildenafil. So sildenafil and tadalafil are approved for pulmonary artery hypertension also. And it has been found that tadalafil is a drug which can decrease the growth of prostate. Prostatic hypertrophy can be reduced by tadalafil. So it has been approved for BPH also, benign prostatic hyperplasia also. And tadalafil is a longest acting phosphodiesterase inhibitor. Tadalafil is the longest acting phosphodiesterase inhibitor. So three uses of phosphodiesterase 5 inhibitors, erectile dysfunction, all can be used. Pulmonary artery hypertension, sildenafil and tadalafil are used, and for BPH only tadalafil is approved. So these are phosphodiesterase 5 inhibitors. And these drugs in particular are avoided with which drug? That is very important MCQ asked. Yes, avoided with nitrates, because they can lead to severe hypotension, so they should never be given with nitrates. Okay. Then coming to non-specific phosphodiesterase inhibitors, the drug is theophylline. So we all know theophylline used in asthma and COPD. Particularly in COPD, we can use theophylline by inhibiting phosphodiesterase 4. It has two important actions: one, bronchodilation; second, it decreases inflammation also. Okay. Then pentoxifylline is another non-specific phosphodiesterase inhibitor. It is used in intermittent claudication. Intermittent claudication, its exact mechanism, how it is working in intermittent claudication is not known, but the antiplatelet action is not found to be that important. What is important is it modifies the rheological properties of blood. It modifies the rheological properties of blood. What do we mean by rheological properties of blood? It increases the flexibility of WBCs. No, RBCs. So flexibility is increased, so even in the deformed vessel they can go and pass. Then it also decreases blood viscosity. So by changing these things, it decreases the episodes of intermittent claudication. Okay, so these are important points regarding the phosphodiesterase inhibitors. Okay.